The nurse Linda was monitoring a 35-year-old male patient who was receiving blood transfusion. On assessment, the nurse found that respiratory rate is 24, VP 90/60. So, which of the following is a priority action by the nurse? The answer is immediately has to stop the transfusion because here the patient has the abnormal blood pressure. The next one, full form of NITI, National Institution for Transforming India. The next, third question, which of the following condition is an example of acute organic mental disorder? The answer is delirium, called as acute organic mental disorder. Then, a nurse is analyzing serum laboratory report of a client diagnosed with lung cancer and that has metastasized to the pelvic bone. Which of the laboratory finding is expected? The answer is elevated calcium. Elevated calcium or hypercalcemia of cancer is a common sign or finding in the patient with the cancer and affecting up to 44.1% of patients. Then next one, here the patient underwent cervical 5 and 6, say 6 C6, C5, C6 anterior cervical discectomy. Which priority nursing diagnosis should a nurse document in plan of care of the patient? The answer is potential ineffective breathing factor. Here, the patient went C5 to C6 cervical discectomy. So, the priority nursing diagnosis is potential ineffective breathing pattern. The next one, here, the patient diagnosed with hematological disorder and she has the symptoms like smooth and redundant tongue, ulcers at the corner of the mouth. So, which of the following laboratory findings is most likely in this patient? The answer is low immunoglobulin, or we can also call iron deficiency anemia because so these are ulcers at the corner of the mouth or angular chelosis, smooth and redundant tongue and decreased hemoglobin. So these are the signs for the iron deficiency anemia. And next, elevated RBCs or red blood cells is a sign of polycythemia vera, and prolonged prothrombin time we can see in coagulation disorders and increased WBCs. Increased WBC you can see in infection. Then next one, here the patient has the problem. The patient had a left total hip replacement before 1 month, and after discharge the patient has the problem acute constant pain after 1 month. After 1 month, the patient has acute constant pain in the left groin and hip area, and he is feeling like left leg is shorter than the right. Then he called to the nurse. Then nurse advises the client to come to the hospital immediately. So, which complication we can suspect? The answer is dislocation of processes. Dislocation of processes is the problem the patient had. Then next question. The nurse Linda is caring for the child with hydronephrosis, nothing but excess fluid in the kidney. Which assessment should a nurse perform to obtain most accurate determination of fluid balance in the child? So which assessment? Here the baby has the problem excess fluid in the kidney. So which assessment give the exact report of fluid balance in the child? The answer is weighing the child. Weighing the child. The next one. Alpha fetoprotein is elevated in which of the following condition? Alpha fetoprotein is elevated in which of the following condition? The answer is spina bifida occult. Okay. So the spina bifida, baby's is a condition where baby spine not formed full. The next one, which of the following location is appropriate to screen for the jaundice in the child? The answer is skin of abdomen. The next one, which of the following damage is most likely to occur during direct laryngoscopy? Voice box examination is nothing but voice box examination. And the answer is there is a chance to damage arytenoid cartilage. Arytenoid cartilage.